السلام عليكم طلاب. شلونكم؟ إن شاء الله زينين. بس أريد أعرف إن السلايد يوصلكم، يعني واضح لكم ولا لا؟ نبهوني إذا زحمة عليكم.
وعليكم السلام ورحمة الله. دكتور دكتور بس صوتك يقطع شوية،
يقطع؟
بتقطيع يعني.
هواية؟ هسه؟
لا واضح هسه واضح.
هسه واضح.
تمام. السلايد واضح؟
واضح دكتور.
تمام. طلاب اليوم محاضرة ثامنة عندنا، اللي هي تقريبا تكميلية للمحاضرة السادسة والسابعة. We will talk about congenital malformation in the head and neck، يعني التشوهات الخلقية اللي تحدث في الرأس والعنق. طبعا هذا رأس يعني نقصد به الوجه، وراح نركز على اللبس والماوث since it's your subject. Okay, so first of all we need to know what do we call, or what are the terms that is given to the congenital anomalies, or itself abnormalities. We can say also birth defects, congenital disorder, or congenital malformations. They're all the same terms. They give the same definition meanings, which can be defined as structural. Okay, so a structural anomalies means that, like, if we have a problem in the for example where in the tongue. Okay, so if you have a tongue tie case, this will happen in the case of structural abnormality, and this will lead to a functional anomalies. يعني إذا عندنا إحنا أي إشكال أو أي تشوه في الستراكشر، هذا راح يعني إنه راح يصير عندنا تشوه في الإيش؟ في الفانكشن، في وظيفة الجزء المقصود. Okay, so this will include sometimes can be presented at another time, but we will stop also on the time of the birth, that we can see it actually whenever the baby is born. Okay, so there must be some causes, some reasons for congenital anomalies. صح ولا لا؟ لازم يصير عندنا احنا اسباب لهاي التشوهات. It can be genetic factors like what? Like chromosome abnormality, mutant genes. Okay, so this also can lead to an abnormality. Okay, another reason is environmental factors, like what? Like the mother had a disease before, viral disease, a bacterial disease, but most of all is a viral disease, or the mother is disposed on X-rays, or the other any environmental factors. But we will stop on germinal measles. Okay, germinal measles like الحصبة الألمانية. This if happened in early pregnancy will lead to abnormality in the embryo. Okay, sometimes also can be combined between the genetic factors and environmental factors. We call this case as multifactorial factors. Like what? Who can give me an example? How can it be combined between genetic factors and environmental factors? يعني احنا عندنا أسباب ممكن تكون جينية في جينات البيبي، خلينا نقول الامبريو، let's say الفيتس، أو ممكن تصير إنه عوامل بيئية. أحيانا تكون combined between both of them. بنقدر نعطيني مثال كيف إنه ممكن يكون combined? Who can give me an example? طلاب وينكم؟ تسمعوني
ممكن
ولا لا؟
دكتورة، يعني الإشعاع اللي يكون أحيانا موجود بالطبيعة بسبب تغير بالكروموسوم الجيني.
Stop please wait a minute. اثنين دا تحشون نسويه. Okay, who is talking first? Let me see. من قاعد يحكي؟ Yes, please. Who can answer?
دكتورة، أنا قلت إنه ممكن إن الإشعاعات اللي تكون أحيانا موجودة بالطبيعة أو اللي تكون
Wait.
ناتجة عن مواد كيميائية.
Wait.
تمام.
شلون نحل هاي المشكلة؟ اوكي محمد سعد answer me then answer. I think ما اعرف من بدها تحكي، بس رقية لا مو رقية.
نعم دكتورة أنا حكيت.
ايه اوكي خلينا نسمع اول شي محمد بعدين انتي رقية. اوكي يس محمد. Yes, it's this one is genetically okay, but sometimes there's a combine between the environmental factors and genetic factors. How can you give me an example in this case? Yeah, it could be, yes. This is it can be. Okay, what else? Can you give me another example? Okay. Okay, okay. Thank you, Mohammed. Thank you, Mohammed. رقية. رقية.
نعم دكتورة.
يس أنطيني مثالك.
أي قلت بأنه ممكن أحيانا الإشعاعات اللي تكون موجودة ناتجة عن مواد كيميائية هي تسبب تغير بالجينات، فراح تكون environment بالتالي راح تأثر على الجينات، يعني مثل الإشعاعات اللي تكون ناتجة عن مثل القنابل أو غيرها وغيرها، فراح تسبب تغير بالجينات، راح تكون environment.
Radiation. Okay. Yes, exactly. Sometimes some radiations can make different mutation in the genes, and this will lead to have a multifactorial reason for the abnormalities. I think the Hajar's answer, for example, amount of oxygen effect on developing of embryo. For sure, amount of the oxygen will affect on the developing of the embryo. Hajar. But this is the answer, like an example, okay? So let's continue. Thank you, Ruqayya and Muhammad.
دكتورة سؤال.
I appreciate it. Okay. نعم.
دكتورة الجواب وين ندز مال السؤال اللي دزت لنا اياه؟
جاوبها طالب، اوكي؟ جاوب.
وين ندز دكتورة هسه؟
الفتح. أحمد جاوب أعتقد، أحمد محمد إيش كان اسمه. اوكي خلينا نخلص المحاضرة ونرجع لها، تمام؟ Okay, so
تمام دكتورة.
we said that we have some reasons for the congenital anomalies اللي هي genetic factors, and it can be environmental factors, and combined between the genetic and environmental factor, as your friends gave us some examples. So let's come to some abnormalities that happen in the neck. Just examples given to you. Okay, بس نعطيكم شوية examples. تمام. So branchial cysts. Okay, branchial cysts. These cysts can be appear during the formation of the pharyngeal arch, actually, because sometimes also we can hear or we can see in some books that are mentioned the pharyngeal arch as branchial arch. Okay, so the cysts actually happen or appear in the cases whenever the pharyngeal arch are forming, some liquids will be aggregated in the neck part, and it can be seen as some cysts. Okay, just look at here. This is the branchial cleft cyst in the neck part. Okay, it can be seen later on, or it can be seen at the birth time. Okay, so the second one is thyroglossal duct and thyroid abnormalities. As you can expect it, that there are some abnormalities that can be happen in the thyroid and the ducts that is actually found in the thyroglossal part. And just look at here, it can be seen in the neck part, and this will be some soft cysts and filled with some fluids, and these all can be treated with operations. Okay, medical operations. Okay. كل اللي تحتاجون تعرفون انه الصور يعني هي طبعا متشابهة، الطبيب واحد اللي يقدر يميزها by some physical some ultrasonic tests. Okay, so all you need to know is some examples for these abnormalities, because next year you're gonna take these one by one in details. Okay, so another abnormality is ectopic thymic or parathyroid tissue cysts, and this also, as you can see, this happened also at the time of the pharyngeal branch or pharyngeal posts can be seen, and they also happen by aggregation of the fluids. Some wastes of the cells can be all aggregate and be seen as a cyst in the neck. Okay. Okay, so another one is the lymphangioma. This we call cystic hygroma, and also hemangiomas. They all can be seen as in every part, not just in the neck, can be seen in the face, in the neck, and other parts of the body as a result of aggregation or abnormalities in the vessels, I mean the blood vessels, or in the lymphoid. Okay, so these all you need to know examples for the abnormalities that can be seen in the neck. Okay, let's come to the tongue tie. This case can be seen in most of the time, and in the most of the babies, in some cases. Okay, and we call this case, I mean the tongue tie, as ankyloglossal also scientifically. And the case itself is the tongue will not be freed, okay, from the floor of the mouth. As you see, it's the tongue itself is connected to the floor of the mouth. Okay, so normally whenever the tongue is forming, as we mentioned it before in the previous lecture, and we said that some swellings will be fused and found in the floor of the mouth, but by the time the cells that's connecting the mouth, the tongue to the floor of the mouth is connected by some tissues. Okay, and these tissues are degenerated or undergo a degeneration process. Okay, but just a part of this tissue that we call frenulum tissue will stay to anchor or to connect the tongue to the floor of the mouth. واضح؟ أعيدها بالعربي. No. احنا شرحنا الموضوع ايش؟ مربوط بقاع الفم. ارتباط قاع الفم هو من بدايته لنهايته عن طريق مجموعة من أو عن طريق تيشو خاص به. أوكي، نسيج خاص. لكن خلال الوقت، مرور الوقت ونمو البيبي، خلينا نقول الفيتس، الجنين، راح يصير عندنا degeneration. زين، degeneration للتيشو الموجود between these I mean the tongue, the floor of the mouth. لكن في حالة واحدة فقط، إنه إحنا عندنا نوع تيشو نسميه إحنا فرينيولم. أوكي، اللي هو فقط هذا راح يربط اللسان بقاع الفم في نقطة واحدة فقط من النهاية، خلينا نقول. أوكي، فبهالحالة شو راح يصير اللسان؟ راح يصير اللسان من النهاية free. واضح؟ حتى يقدر يبتلع، يقدر يتكلم، لا يأثر على functions of the tongue. Okay, but the most common form in the frenulum extension is to the tip of the tongue. شو راح يصير بهالحالة؟ هذا الفرينيولم في حالة التونج تاي راح يمتد لنهاية اللسان ويمنع إنه اللسان يكون حر في نهايته، خلينا نقول في the tip of the tongue. واضح؟ So the tongue in this case will be connected or anchored by the frenulum tissue, and you can see that it's completely anchored to the floor of the mouth. And this case will affect the newborn baby, and in the feeding case, and later on in the speech time. Okay. So let's come to the fascial cliffs. Okay, fascial cliffs. So this is important. Please just focus on it. That we have a cleft lip and we have some cliffs that happen in the palate. Okay, and they both result in the defect in the facial appearance and difficulty in the speech also. Okay, so in this case, we will just take the incisive foramen as a dividing landmark in order to know how, or to differentiate between the cleft itself and to diagnose the case. Okay, and this is the dividing landmark between the anterior and posterior cleft deformities can help us to divide it to anterior and posterior clefts. Okay, so anterior clefts, we have three types of clefts: lateral cleft lip and cleft upper jaw. Okay, and we're gonna have a cleft between primary and secondary palates. Okay, this is regarding the anterior part of the mouth. So we need to know that there must be a reason for these clefts. Okay, there must be a reason for the cleft. طبعا هو شق ممكن يحدث في اللاترال ليب، يعني ممكن يكون في الشفة، في الفك، في الباليتس. واضح؟ هو عبارة عن شق يحدث في الليب، جو يعني الفك and in the palates. اوكي زين. منطقيا إذا نريد نفكر شلون هذا الشق يحدث، هو أكيد احنا قلنا من قبل انه كيف يتكون كل جزء من الفم، خلينا نقول كل جزء من الفيس part or mouth part, and we said that some fusion will happen, isn't it? So if there was a lack of fusion in this case, there must be a cleft. So a cleft case will appear. How we can see that in the case of the lateral cleft lip, upper jaw cleft and cleft between the primary and secondary palate happen due a partial or complete lack of fusion of what? Of maxillary prominence in one or both sides. I will show you some pictures in order to have a vision for it. And then you need to know some informations about the prominences that form each part of these, I mean the jaws and parts of the face and mouth. Okay, so you need to know that any lack of fusion of the maxillary prominence in each side or on one side can lead to have a cleft in one of these parts. Okay, regarding the posterior part of the mouth, we have a cleft that can happen in the secondary palate, and we have cleft of the uvula. Okay, uvula. The cleft of the secondary palate, the reason for it is the lack of the fusion of the palatine shelves. We said before how the secondary palate formed due to the fusion of the palatine shelf, isn't it? The lack of this fusion happen according to, due to the environmental factors, like the mother is a smoker or having certain medications, and also some diabetes mellitus patients may have this case in their fetus. Okay, so look at this. As you see right here, we have a normal mouth case, and you can see we have the primary palate, incisive foramen, and the uvula. Okay, in the second case, you can see there is a cleft right here. We can call this case as unilateral cleft. Okay, first of all, uni. Why? Because it's in one side. جهة واحدة نسميها احنا uni. Okay, unilateral cleft lip. Okay, but it's not just in the lip. مثل ما تشوفوه هو مو فقط في الشفة. Okay, this is extended to the nose, and this will affect most of the mouth, the lip part, and also in the breathing time. Okay, and the second part, the SEEP case, the second case is also unilateral case. Okay, as you see, it's in one side. تشوفوها هي من جهة واحدة. احنا شو راح نقول؟ أول شيء راح نقول unilateral cleft، طبعا involving many parts. أول شيء عندك lip، وعندك jaw، وعندك also إيش؟ عندك also the palate. أوكي، هو extending the palate. واضح؟ نيجي للحالة الدي، خلينا نقول الثالثة. بس ما تشوفون عندنا بالجهتين. So as you see, we have in the both sides we have a cleft case. So first of all, you can say that it is bilateral cleft. Why? Because it's in each side. This will involve the lip and jaw. Okay, lip and jaw. Then the E part, you can see that there is a cleft palate. Okay, and in the F we have a cleft combined with a unilateral anterior cleft lip. Look, it says anterior cleft lip لأنه هذا أخذ له من الجو من الليب and extending to the nose. واضح؟ إذا أول شيء راح تسووه من تجيكم أي حالة إنه نشوف لكم إياها، أقول لكم diagnose the case. أنت لازم تشوفه أولا is it unilateral or bilateral. بعدين راح تشوف إنه extending or involving which parts. Okay, jaw parts, cleft parts, incisive okay, or in the case of the extending to the nose كلها لازم تذكر لي إياها. زين. Another case we have is oblique fascial clefts, and this will result from the failure of the maxillary prominences, and they will fail to merge with its corresponding lateral nasal prominence, and there will be a nasolacrimal usually exposed to the surface. Okay, look at here. There are some cases also found. We can see that the nasolacrimal parts are usually exposed to the outside. Okay, we call it as oblique fascial clefts. And also median cleft lip. And this case is rare actually, and caused by incomplete merging of two medial nasal prominences in the midline. Look at here. So look at this case. You have a lateral cleft lip, okay, and bilateral cleft lip in this case, okay, and this case is midline cleft lip, okay, the D part. This one is midline cleft lip. واضح? This case is cleft palate, and this is the bilateral cleft lip. What about this one? Is a lateral cleft lip. ليش؟ لأنه it's in one side. واضح؟ هذا الكيس الأخير حنسميه midline cleft lip. واضح؟ زين. الكيس هذا هو uvula cleft. تشوفوها؟ Uvula clefts, and this happen, we said, as a result of some environmental factors, as a mother is a smoker or sick, or she has a diabetes mellitus case, or have some medications. Okay, this one, I mean the tooth abnormalities is the last one. So the most popular one we can hear about it is natal teeth. Okay, so erupt during the first month of the age. So they can have some teeth as they are newborn. Okay, look at here, this case. يعني هو الطفل تو مولود نشوف عنده أسنان أو إنه هذا السن في أول شهر من ولادته. Okay. Abnormalities in number, in shape, and size. Also, it can be discolored. Why? Because the mother had some medicines that are not suitable for the pregnancy time, like a tetracycline. So they will be discolored, as in this case. Look at here. And deficient in the enamel. This can be caused by vitamin D deficiency, and there are some factors that affect the tooth, including the genetic and environmental factors. Okay, so any questions? So this is the deficiency of the enamels. Okay, and also there are some abnormalities in the shape and number. Okay. So any questions? أنا راح أستمر الشرح إلى الامتحان بس ما راح أدخل كلها.
اي والله دكتورة الكثيرات حيل.
هو الكتروني ماكو داعي تشتكون على كثرته.
دكتورة بس صعب
دكتورة
وذلك نريد نقرأ.
عود اتفق ويا شو اسمه، افكر فيها اتفق واعطيكم خبر. اوكي، اعطيكم خبر ويا احمد
مو
ان
على
شاء
قراءة
الله.
دكتورة، على الدور بيها كثير، يعني اذا ندور كثير.
اليوم شو السالفه، الكل يحجون سويه.
دكتورة هسه السؤال اللي دزيتي لنا اياه وين ندز الجواب وين؟
السؤال بعد ما يحتاج لانه هو جاوبها، وما يحتاج، بس راح انزل لكم الفورم حتى شو اسمه تسوون.
يعني دكتورة بس هو حصل درجة،
حبوب.
احنا نريد درجة.
مو انا ما أعرف الدرجه هيك، لان قلت لكم اول من يجاوبها راح اعطيه له ستار، وهو قبل لا تخلص المحاضره جاوبها.
ما شاء الله على دكتورة.
والله جاوبها يعني. اوكي، الجواب هو شنو كان السؤال؟ اولا ركزوا عليه لان انا اجيبها. السؤال
دكتورة اصلا
انه
ما اعرف السؤال
ليش،
شنو.
هو راح هسه اشرح لكم اياه. السؤال انه ليش بالعربي بتجي فيه، خل اقولها ليش.
اي والله دكتورة.
احنا الفارينجل ارش ليش عنده هيجي اوريجينات، خلي عنده ليش يحتاج انه هالقد لايرات، خلينا نقول الاندوديرم والاكزوديرم واندوديرم واكتوديرم وميزوديرم ونيورال كريستالز، كل هذا يحتاجها. ليش؟ شنو اللي دا يختلف عن الباقي؟ يعني ليش ما هو يحتاج فقط اندوديرم؟ ليش ما يحتاج فقط اكتوديرم؟
ليش دكتورة؟
من يقدر يجاوب هسه؟ بس ما بيه فايدة.
دكتورة
ما
هذا
جاي
اي
يصير
دول
تسجيل
توقف؟
جاوبوا شوفوا اللي يعرف. وليش
لأن
يحتاج
الطبقات
نيرف
الثلاثة تعمل معا.
وكارتليج اي
لا دكتورة، لأن الطبقات الثلاثة تعمل معا، فلهذا يحتاج إلى 3
نعم.
طبقات.
يعني صح
عافية
تعامل
احمد
معا،
عافية.
بس يعني احتاج ديتيلز، مو جواب راسا هيك. احتاج ديتيلز.
شلون
هو
دكتورة؟
يحتاج 3 طبقات. شوف، يحتاج 3 طبقات، ويحتاج نيورال كريستالز، اوكي، زائدا
صحيح
انه يحتاج نيرف وكارتليج وارتري.
دكتور هذا
دكتور.
ما يشبع، يحتاج هالكثر.
ليش ده يحتاجها؟